Hello, can you please introduce yourself and tell us a little bit about yourself?
Yes, my name is Dr. Rodney Dunetz. I'm an acupuncture physician, a doctor of Oriental Medicine. I've taken the doctoral program, graduated with a doctorate degree in the first doctoral program on the East Coast of the United States. I've been in practice for 8 years. I'm an NCCAOM diplomat of acupuncture. And in November, I was appointed by the governor for the state of Florida to the Board of Acupuncture for the Department of Health for the state of Florida.
Why do you think it's important to regulate acupuncture or Oriental medicine on a state level?
Well, first, of course, we have to kind of look at the word regulate. Regulate kind of implies you kind of, shutting it down or turning it off or that type of thing. But really, the regulation is done really to protect the public, which is one of the very important parts that the Board of Acupuncture does. But at the same time, to raise the standard and raise the standard that acupuncturists are adhering to in the treatments of their patients. And at the same time, to raise the standard of education, which is, of course, one of the missions that NCCAOM also has. So it's really about protecting the public. That's really the primary thing that we're all about.
What are some of the current trends for practitioners in the state of Florida right now?
The current trends, we're seeing a lot more of what's called functional and integrative medicine. So it's not just being done on its own. We're seeing the ability of practitioners to work more with Western medical doctors, and that scope of practice is continuing to grow in those manners based on the fact that acupuncture has a wide variety of techniques that they can employ in treating patients to make them healthier.
What are some of the most rewarding aspects for serving on the Florida Acupuncture Board?
Well, that actually has been kind of a continuation of what I've been doing already for many, many years. I spent 8 years on the Florida State Oriental Medical Association Board of Directors. When I got appointed to the Board of Acupuncture, I had to resign because of a bit of a conflict of interest there. But I don't really see it as a conflict of interest because I think that when you're promoting the safe practice of acupuncture, you're promoting acupuncture. And so it's just an extension allowing me to go and really do things that are about raising the level of this practice of acupuncture in America, in the state, and allowing people to do something that is a very safe and effective treatment protocol for many, many, many people.
What do you see for the future of the AOM profession?
The future is explosive. Right now, basically about 3% of the population has even been exposed to acupuncture. That leaves 97% of the country that are potential patients who can find the benefits of acupuncture. They're really miraculous benefits that occur. And so we have that growth potential, plus we have the integrative and the complementary components of working with Western medical doctors, and we're seeing that just exploding also. We're seeing referrals both directions where, of course, we do want acupuncturists to be referring out if they need to, but we're seeing now medical doctors that are referring to acupuncturists, and that collaborative effort to get the best treatment protocol for the patient, the best outcomes for the patient. We see that continuing to be a factor that is really, really growing.
How did you become involved with NCCAOM?
It's really been an evolution over the years. Of course, when I graduated from school and decided I would go ahead and go forward with becoming a diplomat, that was because I really felt it's important to raise the level of standards, the level of education, and also that there's somebody on our side to do that. And NCCAOM really has taken the lead first on the state levels and now on a national level. They kind of almost have become the national organization in my mind because they're the ones that are really leading the way at making the standard for how acupuncturists practice be able to be judged in a consistent manner from state to state.
Why do you think NCCAOM certification is important?
I really think it's actually exceptionally important, and I personally use it if I'm referring patients out, because I have a lot of people that come from out of state, and they'll say, hey, I have a cousin that's in California or somebody that's out in Utah, and who should I refer them to? And NCCAOM, that's the go-to place for what I tell them to do, because I know that the person is going to have educational standards that are above and beyond the typical state licensing standards, and that I'm just confident that that person is going to be coming in contact with a practitioner that has the knowledge and the ability to treat them properly.